This is Tara Parker, and I will be doing the Western Kentucky University Motor Speech Examination. Can you state your name and how old you are?
Clayton Wiley, 23.
Awesome. So today I'm going to be looking at your facial symmetry, making sure all your cranial nerves are in check. Do you have any personal history of swallowing difficulties?
No.
Do you have any family history that you know of anybody that has swallowing difficulties? No? Awesome. So we will get started. First, I'm going to look at your facial symmetry. Now, not everybody has perfectly symmetrical face, so I'll look at you. It's pretty symmetrical. Awesome. It's looking really good. It's the midline, and then both sides looks great. All right, I'm going to look at your jaw structure, so I need you to look this way. Good jaw structure. Other side. Awesome. That looks really good. Nice line there. All right, now I'm going to look at your lip structure. So they're pretty symmetrical. You have a resting, closed lip. The dog wants it. The resting lip looks good. Okay, I'm going to test your range of motion on your lip. Could you pucker, smile, open your mouth, move your lips around? Pucker again, up and down. Looks good. Awesome, good range of motion. Now I'm going to look at your tongue structure. So can you stick your tongue out, move it to side, around, up, down. Awesome, good range of motion there as well. All right, now I'm going to look at your teeth. So can you scoot up to the camera for me? Open. Awesome. You have all your teeth. You have a retainer on top and a retainer on bottom, but that doesn't seem to affect your speech at all. Awesome. All right, now I'm going to look at your hard palate. I'm going to use the flashlight. Can you see closer to the camera, please? Open. So your hard palate looks good. No cleft palate. It's all there. A slightly high arch, but overall looks good. All right, and now I'm going to look at your soft palate, which is your uvula. It should raise when you say "ah," so I'm going to have you do that. Scoot forward. Awesome, okay. Ah. Good, you have a good resting position. When you say "ah," it raises. Awesome, looks good. So all of that looks good. Now I'm going to test your gag reflex. Not everybody has a gag reflex, but most people do, so I'll test it. Once you have that reflex, I'll stop. So open. Got it. Yep, you definitely have the gag reflex. All right, next I'm going to do the velopharyngeal function, which is just how your soft palate is functioning. It needs to open and close when you're talking, and when it should raise, so no emission should be coming out of your nose unless it's a nasal sound. Okay, first I'm going to grab the mirror. All right, I want you to sustain for me, and what I'm testing here is I'm going to see if the mirror will fog up to make sure the air is coming out of your nose as it's supposed to. So, Yep, and it did fog up. Very good. All right, now I want you to say humbug, and there should be little to absolutely no fog on the mirror now to make sure your palate's functioning properly.
Humbug.
Good, just a little when you said but overall looks really good. That means your soft palate's working like it's supposed to. Your saliva control seems to be in check. Do you have any trouble controlling your saliva, resting or speaking?
No.
Awesome. All right, now I'm going to look at your respiration during speech. Do you ever find you're out of breath while talking?
No.
No? Awesome. All right, I want you to count to 10 for me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Awesome. So your respiration during speech seems good. All right, now I'm going to look at your ears and your ear structure. Can you turn to the side for me? Your ears look good. Other side. Strong pinna. It seems that nothing would allude to you having hearing difficulties due to your external ear. So all of that looks great. All right, next I'm going to check all your cranial nerves and how they're functioning. First, I'm going to start with the trigeminal nerve. So can you open and close your mouth slowly? Awesome, that looks pretty good. I'm going to have you open your mouth again, and I'm going to put some resistance now. So close. Now open. You can still open your mouth really easily with my hand there, so that's awesome. I want you to protrude and retract your lower jaw. Yep, perfect. Looks good. Now move your jaw side to side. Yep, good motion there too. click your teeth together a couple times. Awesome, looks great. Now I'm going to palpate your masseter muscle, which means your masseter is right here. I'm going to have you kind of lock your jaw, like clench your teeth together. Yep, your muscle there seems very strong. I feel it coming in and out. I'm going to do this side. Awesome, you seem to have strong muscles on both sides, so that's looking really good. All right, now I'm going to have you tighten your muscle under your chin. So tighten that muscle. Yep, I can feel you tighten and loose. That's really good. Looks awesome. All right, now I'm going to have some test your sensations on your face. I'm going to have you close your eyes, both eyes, and I want you to tell me where you feel the cotton ball. So close your eyes.
Forehead, cheek, chin.
Awesome. So you're feeling all of those, which is awesome. All right, now I'm going to set the timer. I'm going to have you say puff, puff, puff for 5 seconds. So let me start the timer. All right, so I need you to say puff, puff, puff. Start now.
Puff, 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 puff.
Awesome, looks good. And I'm going to have you do the same thing again. Hold on 1 second. Begin.
Puff, 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 puff.
Awesome. All right, now I'm going to check on your facial nerve. As I said before, your facial symmetry is very aligned and pretty good, so that looks great. I need you to wrinkle your forehead. Awesome, good job. Close your eyes tightly. Good movement there too. I want you to pucker your lips. Nice, looks good. And smile. Smile with your teeth. Good job. I want you to show your teeth and pull down the corners almost like you're going to growl. Down. Yeah, perfect. Looks really great. I want you to alternately puff your cheeks on either side. Good. Your corner of your mouth kind of moves with that too. So, all right, now I'm going to use what's called a bite block, and I'm going to have you bite down on it, and you're going to do the same thing, puff, puff, puff for 5 seconds. So I'll start the timer. All right, I'll tell you when to begin. So puff, puff, start.
Puff, 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 puff.
Great job. Okay. Next, I'm going to look at your taste. I'm going to do 4 tastes. So I'm going to do sweet, sour, salty, and bitter. And I'm going to use a swab and dip it in the taste. And I want you to stick your tongue all the way out. And I want you to tell me when you can taste the taste. So, let's start here. So tongue all the way out. Tell me when you can taste it.
Sweet.
Sweet, and you can taste it on that side and both sides.
Mm-hmm.
Okay, awesome. All right, we'll move along. All right, here's the next one. I want you to tell me where and when you can taste them.
Sour.
Sour. Okay, let me keep going. Sour still? Okay. We're going to move on. Next taste. Tongue all the way out, please.
Salty.
Salty. I'm going to keep. Can you taste it over there too? Okay, awesome. And last one.
It's bitter.
Oh, bitter. Okay. I'll let you have a drink. Awesome. So your taste looks good. Everything with that nerve seems like it's going great and working properly. I'm going to take another look at your palate again. So I'm going to have you come back closer to the camera. Let me see in. Nice yawn to look at your palate. All right. Open. So your palate at rest looks really good. It is steady and the pillars are very parallel to each other. Now I want you to go, ah. Awesome. So the uvula raises when you're saying ah and almost disappears. So that's a really good sign that everything's working properly. All right, next I'm going to have you lean forward again, and I'm going to text your lifting reflex. So what that is, it's not the gag reflex again, but I'm going to touch up near the uvula and make sure that soft palate is going to lift. So please scoot forward. Awesome. So your soft palate lifted as I touched that. So that's working great too. All right, next I'm going to test your nasal emission again. It looked great the first time. We're going to do it again. So I want you to tell me, you can tell me your dog's name.
Dog's name's Wrigley.
Awesome. So not a lot of nasal emission there, so that's looking good. That air is not escaping through your nose too much when you're talking. All right, now I'm going to have you blow out of your mouth. Good, no nasal emission there either, so looks awesome. Now I want you to puff your cheeks while you're protruding your tongue like this. Awesome, great, you can do that too, so everything's looking good. All right, next I'm going to move on to your vagus nerve. I want you to inhale deeply, and then I want you to hold your breath as long as you can with your mouth open. So begin. Great, looks good. All right, I'm going to have you do that one more time. So inhale deeply and then do the same thing whenever you're ready. Good, that seems pretty normal. All right, now I'm going to have you inhale, and I'm going to have you say 3 different sounds and hold them as long as you can. We're going to start out with ah, so begin when you're ready. Awesome. Now I'm going to have you do s. Great. Now z. Great. I'm going to have you do ah again. Now s. Great. Now z. That's awesome. Your respiration or phonation seems like it's pretty on par with normal. All right, now I'm going to have you match several pitches. We're going to go to low, medium, then high. So, ah, can you try that for me? All right, it's kind of hard for you to go high pitch sometimes, but that's okay. Now, can you cough for me? Awesome. Now you're going to do a glottal coop, which is whenever you kind of stop your voice in your throat, like, can you try? Try again, like in the back of your throat. Close. All right. Now I'm going to look at your spinal accessory nerve. So I want you to turn your head towards my hand. Other side. You have no trouble. That's not a lot of effort for you, is it? Good. So that looks awesome. And now I'm going to have you push forward on. Good. So that's not hard for you either. Now shrug your shoulders. Good. So everything with the nerves I've done so far has been looking pretty normal. So we're going to move on. All right. I'm going to look at your tongue. All right. Open up. Yeah. Your tongue at rest looks pretty good. All right. And you retracted your tongue, so stick your tongue out. Now retract. Good. There's good motion there too. All right. I'm going to have you stick your tongue out and move it side to side. All right. Other side. Perfect. That looks good too. All right, I want you to stick your tongue out and lift it up. Good. Now I do the same thing, but lift it down. Yep. Perfect. Awesome. You know what I was going to say. All right, I'm going to have you put your tongue on the inside of your cheeks. So do this side first. Perfect. That looks good as well. All right, I'm going to have you, and then your strength through all of those tasks looked pretty good as well. Now I'm going to have you say some other sounds. We're going to do ta-ta-ta. Let me get my timer. All right, so ta-ta-ta, begin.
Ta-ta-ta-ta-ta-ta-ta-ta-ta-ta-ta-ta-ta.
Perfect. And again.
Ta 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 ta.
Awesome. And now I'm going to have you say ka 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 for 5 seconds. Let me get this. Begin.
Ka 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 ka.
Awesome. And again.
Ka 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 ka.
Looks good. All right, now I'm going to put the bite block in again, and I'm going to have you say ta 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 for 5 seconds. So bite down. Begin. Ta.
Ta 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 ta.
Nice. Again, ta.
Ta 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 ta.
Great job. Now I'm going to have you say ka 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 with the bite block. Begin.
Ka 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 ka.
Awesome. And ka again. Begin.
Ka 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 ka.
Great job. All right, I'm going to have you say pataka for 5 seconds. Begin when I tell you. Pataka. So begin.
Pataka, 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 pataka.
Great job. Now we're going to do that same thing with the bite block. Start.
Pataka, 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 pataka.
Awesome job. You're saying those really well with and without the bite block, so your lips are getting good range of motion to produce those sounds, so that's a really good sign. All right. Moving forward, I'm going to test your oral reflexes. So first, I already did your gag. You do have a gag reflex. I think it's about 20 to 30% of adults do not have one, but yours is present. Next, the following reflexes should be absent because you're an adult, but I'm just going to check just in case that you don't have those. First, I'm going to do your jaw jerk. So see if your jaw jerks. It does not, so that's good that it's absent. Next, I'm going to do sucking. So when I do that to a baby will suck on that. So you don't have that. Next is rooting. Yeah, so when I do that to a baby will turn its head. So that is absent on you too. So I'll do the snout. No reflex there either. And now bite. And you don't bite, so that reflex is gone too. Awesome, so all of that looks great. Next, I'm going to evaluate your oral control and sequencing, so whether you're able to do multiple things in a sequence and see how that works with your tongue and your lip movement. So first, I'm going to have you cough. Awesome. All right, click your tongue. Awesome, so you can do that. Blow this tissue. Awesome, so there's air moving out there. Puff out your cheeks. Awesome, good job. And stick out your tongue. All the way. Much better. Awesome. Lick your lips. Lick all the way around. Awesome. Good movement there. Make your teeth chatter. Perfect. Good fast movement there too. Buzz like a bee.
Bzz.
Buzz. Get that buzz in there.
Bzz.
Awesome. Good job. Smack your lips, then cough. Good job. All right, bite your lip, then blow me a kiss. Awesome job. So yeah, everything looks really good. You're symmetrical. Everything seems to be functioning properly. You have really good range of motion on your lips and your tongue. Ears look great, and you said you don't have any personal history of swallowing. So from this examination today, everything looks like it's functioning properly. You did have some trouble matching pitches, but that's more voice related and isn't going to necessarily affect your swallowing or any of your lip movements. So everything looks fantastic. So thank you for joining me.